All right, folks, so here comes the first full video, first time in 4 years. Thank you for your patience. Got a little grayer in the meantime, a little greasier. I had another patient no-show to my lactation clinic, so I have extra time to do this. And here it is. I'm going to talk to something I got a message about this morning, which is nursing staff asking what nipple cream they should order because they can't access medeolanolin like we usually have for our patients. And they said, what? They asked me which cream, which alternative is healing, and that they looked into some research about a certain kind, and it looked like a cream that has evidence behind it for healing. Internally, I'm having the world's hugest eye roll. I'm just going to be honest. Not because this person by any means said something wrong about this, like that they're asking me the same thing under the same assumptions that everyone has, and it has to do with something that really gets my goat: people making money off of moms who don't know enough and are told by medical staff things that reinforce things that aren't true, and given products based on misconception. Let's just get right to the point. The point is, lanolin is not going to heal your messed up nipples when you're breastfeeding. There is no cream under the sun. There is no treatment under the sun. There is no hydrogel, no vibrating breast massager, no silver cup to put on your nipple, no nothing that is going to heal your nipples, like heal them. No, it may feel soothing to use one of those products, but if there's something like pain or bleeding or skin flaking, dryness, discharge, like anything that's funky with your nipples while you're breastfeeding or pumping or both, it's because there's something wrong underlying it all, that the root cause that has to get addressed. And if that doesn't get addressed, no product is going to truly heal. It's going to actually have maybe like a 20% chance of making things worse. The top things that make things worse are overuse of nipple cream or lanolin, like several applications all day, every day for days on end, and or nipple covers that have no air circulation, like silverettes. I will do a post another day on silverettes. Don't get me started on that right now, but I'm just gonna say don't use them. There's nuance there. You could get away with using them a little bit, maybe some people, but we're gonna say don't use silverettes. Anyways, so the nipple cream situation, why won't it fix things? It's not addressing the root cause. What is the cause of the nipple pain? It's going to be one of a couple things. The baby's not latching right, and it may not be any fault of the mother. Often it's just mom needs a little extra support. You need a little extra pointers, like one-on-one from a lactation consultant or another mom who knows what she's doing. Like, it doesn't have to be a paid expert, just someone who can come in person to you and put their hands on you if needed or not, or just tell you verbally what to do with your positioning of your baby. Takes 10 minutes max, a couple seconds usually. I can usually help someone with, I usually don't touch anybody ever, because it's not necessary. Moms know what to do. Just a little couple words of coaching. Maybe I'll turn the baby's butt a little bit if mom's having a hard time with the verbal coaching. But it's usually little tweaks that are made in a matter of seconds, and boom, the problem's fixed. The latch is not painful. Or if it is, there's a problem with baby's anatomy possibly, and I'll do a different video on tongue tie. If the baby has a piece of skin under the tongue that looks prominent, is really, really visible, it doesn't mean that that's affecting the latch. That's not what that means, but it depends on other factors. So I'll do another video on that someday, because I have a lot of thoughts on that as well. The other common cause of nipple, so there's the three things. I'm just scattered here. I'm not editing videos, forgive me. It's the poor latching. The other one is overuse of emollients or topical coverings of the nipple. So occlusive, i.e. air cannot pass, items put on the nipple, and the more often that's done, the more constant that is, the less airflow there is, thereby the nipple cannot heal from that basic micro trauma of breastfeeding, especially when it gets started after birth. That's cause number 2 of nipple pain, especially in moms who are in the demographic or in the social circles where silverettes are really popular, where product use is really popular, often moms with more resources than moms who have less resources, who are buying a ton of different things being advertised and sold to them in all the ways about, get this for breastfeeding, it's going to help with nipples, it's going to help with milk supply, and you're just getting ripped off. I'm just going to be real, you're getting ripped the F off. This is not going to be a super professional YouTube channel anymore. I'm just going to be very myself and not as professional as I am in the clinic, because you are not my you're not my patient. So I'm just going to talk really real and sometimes drop curse words. So keep watching if you're okay with that. And I'll try to not drop too many I'll like use letters and acronyms. Anyways, so the third cause of, also I have ADHD, so I'm going to be jumping all around the place, which makes me interesting and weird and sometimes confusing to people who don't think like me. So keep watching if you're into that. So basically the third cause, what was I saying? I'm also real tired. The commute is 2 hours here. Pumping. Flange size inappropriate, maybe. Almost always it's not the flange size. Currently, I don't know what's going on, but there's this like hyper laser focus on flange size, flange number, how things look when the nipple's moving in and out. Everyone wants to measure their nipple. I don't know what's going on with this fad. I think it's helped people, but it's not it's actually, I think, made things worse. When I started doing lactation 15 years ago, no one was measuring. They were using flange sizes a lot larger than are being used now, and things were fine. Maybe like 5% of women were really messed up from not using a small enough size, and those people are well served by this new fad. The majority of people, it's not the flange size. I haven't seen make a significant difference in supply or in pain level for the majority. Not all. Some women do need that little micro tweak, the smaller size, but the vast majority of women, honestly, it's not serving them. It's just like this hyper-focused, data overload, data obsessed, TikTok obsessed, like, do this and your problems will be solved. We want the solve. There's some societal shift where that's happened. But it's rarely the flange size that's causing the root cause of the nipple pain. It's the suction level. Everyone's got their pumps turned the FF. I don't know why engineers are making all the pumps are made to go to like max force brute mode. No one should ever use the high level on any pump. Maybe there's a pump out there that I don't know about that the engineers actually realize we don't need to suck a mom's nipple out into the universe. Like, let's just make it reasonable. But all the pumps I've come across, you can turn it up to like level 6 billion and 5, and it'll say level, 10 or 12, but it's like no one should ever pump on these high levels. If it doesn't cause immediate nipple pain or damage, in the long run, if there's a lot of pumping, guarantee you there's going to be pain. And it's usually pain after the pumping session, if not during. Like, why do my breasts hurt? There doesn't seem to be anything wrong visually or otherwise. What's causing it? Sometimes it is the suction's too high. So like on a Spectra, if you're using suction 9, that's probably the problem. I've rarely met a woman who tolerates that with no long-term issues. On a Medela, there's different levels, but let's just keep it as low as you can to get the milk out. That's my advice. If you do that, it's really hard to go wrong. Seriously. Pain inhibits the letdown reflex, so there should never be pain with pumping. There should never be pain with breastfeeding. And nipple cream ain't gonna fix it. A nipple cover ain't gonna fix it. No product can heal you. I mean, it's logical. Like, how did people survive? You're here because for thousands and thousands and thousands of years, your ancestors breastfed you with no products. Not you. They breastfed your ancestors below them with no products. Like, that's literally why you're here, is because that was happening. There wasn't Nestle formula. Granted, society was very different, so it's not like I do it alone and I don't need formula help and I don't need a product. Hell no. It was for thousands of years, forgive me if I'm lecturing if you already know this, but I think most of us don't just think about it. For thousands, tens of thousands of years, hundreds of thousands of years, however old this place is, it seems pretty old to me, humanity, it's been women together helping each other, which means if your baby has a tongue problem and it's messing up your nipples breastfeeding, a granny is going to intervene and be like, pop that baby on Sister Sue's boob, like one of the many other lactating women around you. And it's completely normal in that context in the old times, and still today in some cultures, to just be like, okay, I'll breastfeed your baby for you. And that's how the baby stays alive. And I'm not saying we go back to that. That would be strange and difficult in our current US modern society. I'm not recommending that per se. I'm just saying, I don't know what I'm saying. I'm going off on a tangent. This might be a YouTube channel that's a lot of tangents. It's basically me emotionally venting. And thank you to anyone who listens. I need to go to a lactation conference and just connect with people who can relate, but I don't work with any lactation consultants in my clinic. Well, there's one, but we're just busy and we don't get to chat. And it's also rare that I meet other folks like in this profession who see things the way I do, who think the way I do, who've been doing as much of it for as long in such different capacities. Plus I have this, not that I'm better, but I have this other background of like the nurse practitioner mind and like many, many, many years of overtraining, too much education, to be honest. And then like education in other realms like gender studies, spiritual work. So like kind of this collective view of like how energies of moms and babies interact. A skeptical lens, maybe it's from my Celtic Gaelic ancestors from the Green Isles up north that I'm from, that are just always speaking truth against power. But like, I'm not here to talk shit about capitalism, but there's so much capitalizing that has popped up in the last 5 to 10 years on moms and moms' pain, their nipple pain, their suffering, their lack of accurate information about how breastfeeding works. And so many moms are getting sold products as if they need them, as if they're gonna help, and they won't. So if you ask me, is this nipple treatment, insert any treatment here, is this gonna heal me? My answer, almost always, nothing's ever 100% of the time. There's always caveats, there's always unique cases, right? But generally speaking, nothing will heal that symptom, that nipple trauma, except addressing the root cause. There are items that are safer than others. Many of the items sold to women are not harmful, which is good, except for silverettes. I've seen them cause so many problems. But will they heal? No. Addressing the root cause will heal. Having someone who knows about lactation, whether it's a friend, a family member, a lactation counselor, a midwife, a nurse, your doctor, like anybody who knows what they're talking about. And P.S., a lot of people say that they know what they're talking about, especially on social media, and they are often at least somewhat misinformed. No trash talking on them. I'm glad they're trying to help. I just am sad when I have to clean up after that, when women are like, but I thought, and I'm like, no, honey, that's not so. But if you like have someone you know who's talking about what they're talking about, it's like in 10 seconds, the problem is fixed. And I'm grateful to be at a place in my career where it takes me 10 seconds of hearing someone tell me what's going on. I don't even have to see what's going on. Sometimes it helps for me to see. But at this point, I've had so much experience that like I can practically look at someone and be like, here's the problem, do this, and you'll be fine. Is my advice always what people want to hear? Absolutely not, especially when it comes to milk supply. I'll do another video on that, but very sorry to say that there's no product out there that will increase your milk supply. Whoever invents the GLP of milk production will be a fucking billionaire. Like something, because GLPs be working. Ozempic is like this new thing for weight loss that truly works. And as a menopause clinician, I can also be like, actually, yeah, those work pretty dang well. If someone does that for milk supply, where you don't have to pump more or breastfeed more to get more milk consistently, they will be so effing rich. There's no medication currently that gets even close to truly increasing supply. No herb. It's just putting the work in of constant breastfeeding and or pumping, that stimulation, that milk removal. And I'll do a separate video on that, just kind of deep diving into it. And I have a lot of compassion for how disappointing that is for so many moms to hear, because it's truly not fair that people have to take care of the house and go back to work and try to make milk. Like, it's messed up. It's messed up. I wish there was a medication or a oatmeal cookie or a lactation this or that increased supply and made it easier, but no one's invented that yet. So anyways, this will conclude my rambling. I think I'm getting messages, possibly about patients, possibly that are waiting. Feel free to post if you have a story that has to do with your nipple situation with breastfeeding. You're sharing a little bit about your journey. I cannot promise that I have the time to read comments at this time, but I have a goal in the future to at least try to look at some. Again, I have very many jobs and I'm tired, but I'm sure you are too, and you probably understand. If you're a mom, you get it. So anyways, sending my love. Bye-bye.